Hi there, I'm Macdonald Physiotherapist. Welcome back to my virtual clinic. Today I'm going to be talking to you about tennis elbow, or pain in this part of your elbow and forearm. I'm going to be talking to you about what's causing it. I'm going to be talking about what you shouldn't be doing, which could be making it worse, the things that will help to relieve the pain short term and long term, and the exercises that you can be getting on with to reduce your pain. But before I do, I'd like to say thank you very much to those of you that have been sending me so many lovely messages of support. I'm so glad you're finding these videos helpful. Please do subscribe and check out all the playlists I've got going on, which cover all sorts of subjects that I'm sure you will find useful. So, tennis elbow, what is it? Well, tennis elbow is when you have pain. If you bring your arm into this position and you go to the bony bit of your elbow there, and if you just come off that bony bit and then you have pain in this area or anywhere down into the forearm here, that's often called tennis elbow because it is really common with people that play tennis, particularly if you have suddenly increased the amount of topspin you're doing or backhands you've been doing. But you can get it even if you're not a tennis player, with lots of different manual jobs, that sort of thing. So, why are you getting it? Now, these muscles in the front of your arm here, your wrist extensors, they turn into a tendon over the bony bit of your elbow here. And if you overuse these muscles more than they're used to, then you can get some damage in that tendon. So it's actually a tendinopathy. Now, we know that it's a tendinopathy rather than a tendinitis nowadays, because a tendinitis means inflammation, and we know that it's not a nice straightforward inflammatory process. It's a more complicated process that involves change in the structure of the tendon itself. But I'm not going to go too much into that today, because what I'm going to tell you all about is what you should be doing. Before I move on to that, one thing that you really mustn't do, and I've seen it so many times with patients, and that's rubbing it. It's an area that you could sort of that people get a bit carried away if it's a bit sore, trying to rub it and massage it. And all that ends up happening is that it can generally make the area more and more sensitive. The other thing that you mustn't be doing is loads and loads of stretching of the elbow, because again, that can aggravate it. So what can you do to make it better short term? Well, in the short term, what you can do is you can use a strap, and there's plenty of those out on the market. Basically anything that puts pressure through this muscle. As physios, we have ways of using tape that can take the pressure off there, but basically you'll find in any decent pharmacy store, you'll find those kind of straps, or online. The other thing that you can do is have some massage. Now, as I said, I wouldn't massage over the bony area itself, but massage to the muscles both at the front and the back of the forearm can be helpful, as can mobilizing the joints in the elbow. But obviously a physiotherapist needs to be doing that for you. So what else can you be doing? One of the most important things, in fact, the most important thing that I would say, is exercises. So I'm going to run through the exercises that I would recommend that you do now. So I need my little prop here. If we take a bottle of water, it doesn't have to be, just to start with a small bottle of water. What you're going to do is you're going to rest your forearm on something like a table or your own leg, as long as you're comfortable sitting in this position. So I always think it's quite useful to demonstrate this on my own leg, because you know, it's transportable, it moves around with you, and therefore it makes the exercise easy to do more frequently. So you take your bottle of water in your hand, and what you're going to do is, as you can see here, I am resting my forearm on my leg, but there's a tiny little space here where my wrist is, okay? And then what I'm going to do is I'm going to gently lower my wrist down until my water bottle drops down to touch my leg, and then I'm going to lift my wrist slowly all the way up. I'm going to take my wrist all the way down, and then I'm going to repeat that. Now I'm going to aim to repeat that about 30 repetitions every single day. Now, if that's too sore, then it might be that all that you can do is a very small range of motion, and that's absolutely fine. Now, if doing that is too sore for you, then I would recommend that you go and see a doctor. or a physiotherapist. So once you've been practicing doing about 30 repetitions of those, you can then add a bit of rotation. So the other motion that you need to work on is the twisting motion of taking your hand to face the ceiling and your hand to face the floor. Hand to face the ceiling. Now you can see that this part of my arm is staying completely still as I just rotate my forearm back and forth, taking my palm down to the floor and my palm up again. Okay, now you can see here that I've filled up this bottle of water about half full. So obviously you can use smaller bottles of water to start with, or if that's even sore, just using your own the weight of your own hand, and then build up with the weight. And of course, if you've got some snazzy little hand weights, then you can use those too. The next exercise is to look at your shoulder posture, because the function of the function of the elbow and the wrist, but the function of the elbow is very much dependent on the function of the shoulder. So you need to have a really decent, stable shoulder in order to then make efficient movements with the elbow. So I would suggest that you look in the mirror, look side on in the mirror, and make sure that your shoulder isn't dropping forwards. It's a very, very common position for the shoulder to drop forwards. So just check in the mirror and make sure that's not happening. Now, if it is, which is highly likely and very, very common, even in really good tennis players, high level athletes, if you go to the Octopus Clinic website and you type in at the top shoulder stability or even the word swimming, you'll come across an exercise or a number of exercises which helps to work your shoulder blade muscles while your arms move. And that will help to give you the strength to hold your shoulders in the right position so that then your elbow can work more efficiently. The next two exercises that I would recommend are stretches and mobilization of your neck and your upper back. So twist your head one way, twist your head the other way, and continue again for about 30 repetitions. The other one is for your upper back. So you twist round, grab the back of the chair and pull, and then go the other way. Because again, the nerves that come out of your neck and your upper back supply down into your elbows. And therefore, if you're nice and loose in your neck and your upper back, you're less likely to get elbow pain. Last but not least, if those things are still not clearing up the pain, doing some nice gentle nerve mobility exercises, this kind of thing, with or without turning your head in the opposite direction, can also help to mobilize those nerves down the side of your elbow. So do that for 6 weeks. If the pain gets any worse, or after 6 weeks, if it's not got any better, or not got significantly better, then please do go and see a physiotherapist or a sports doctor. It's highly likely that even though I run through those exercises that should help you, it's highly likely that if you're not better after 6 weeks, there's something going wrong with the technique, or we need to progress your exercises to the level that is right for you. On that note, almost forgot, one of the really important things if you are a tennis player is that we address your tennis technique. So particularly, as I said at the beginning, that topspin and that backhand, to make sure that the problem doesn't keep recurring. I hope that's been helpful. Please do let me know your thoughts. Let me know what you would like me to do a video on next, and press that red subscribe key. And until next time, take care. Bye.